ladies and gentlemen. Actually, we have informed that there is an outbreak in Lancashire village. Actually, for that outbreak is started from yesterday or a day before yesterday, when a 4 years child was admitted to the hospital. And actually, from yesterday till today, there is actually around 17 cases. But luckily, there are around 4 cases they were admitted to HDU, and the rest of the cases still in the hospital, but they are not really progressing. And as a government, actually, we are going to express and tell them our expertise throughout the UK to apply their knowledge and in order to control this disease. So here today we give and we brought a lot of expertise to teach you and to tell you about this outbreak and how could you control it. So I hope this is going to be educated for you.
Representing Health Protection Agency, as there are already 19 cases in Lancashire, there are infected by Campylobacter. And for general information about Campylobacter, it's can be isolated from poultry and some livestock and their products. And for general symptoms, people will infected by Campylobacter. For some symptoms like fevers, malaise, and bodily pain, and of course diarrhea, and it may be some cases with severe bloody diarrhea. So as this, we are going to learn people to make good isolations of those have symptoms above, and also be careful when hospital healthcare workers handling those patients. And our agency will be in good contact with each other and make better investigation. Thank you.
Hospital, I'm a medical doctor of the patients. The initial treatment for the first 2 patients involving a single type of antibiotic. Unfortunately, the patient's response to the treatment is unsatisfactory, and now the treatments to all patients involve 3 different types of antibiotics. Besides from antibiotics treatments, IV rehydration is given to all patients with electrolyte replacement. Also, isolations of all cases in the hospital. And for further information, we'll inform you if we have any death or any recovery. And that's it. Thanks.
Food Standards Agency. So we know the disease can transmit through food. So the recommendation of our agency is avoid raw meat and unpasteurized milk, because both of them is the highest rate of the transmission to the disease.
I am an epidemiologist. I want to give some information about this outbreak that happened yesterday. So far, such outbreaks are common nowadays in UK. Especially there have been rising in the outbreak number since 2009. So we are expecting such outbreaks, and according to the HPA, the Campylobacter outbreaks are considered as a leading cause of the foodborne diseases. So far we have 19 cases of the Campylobacter infection. So fortunately we don't have these cases, so we have only infections. So So far, we are working on identifying the real source of the infection. As we know, and as it's known, the possible cause are animal products, especially the poultry products, water source, and so on. So we have sent samples from these potential sources to the lab to identify the real cause.
Hello, I'm representing the government sector from the Strategic Control Department, and I would like to suggest to improve the biosecurity and evaluate the effectiveness of on-farm and slaughterhouse intervention studies, and in addition to that, a rapid on-site test would be a considerable asset to control the current outbreak. Thank you.
Thank you very much for this actually valuable information, and I hope this was educational conference. But don't forget to make sure about the hygiene and standard hygiene, either the food or the water. And also, if you have symptoms that's similar to the symptoms that we have been informed today of this outbreak, make sure and don't hesitate to contact your healthcare services. And also, don't be really worried, and just it's going to be fine, and don't move out of Lancashire. It's not really a disaster, and I think it's under control and under investigation. So it's not a big problem, and if there is anything new cases or something going on new, you will be informed immediately. So it's safe, and thank you for listening.